I heard this particular test increases your chances of getting pregnant. Would you like to give it a try? And I also want to let you know that fallopian tube blockage is one of the leading causes of infertility. Good day, everyone, and welcome back to Nurses Lecture Room YouTube channel. My name is Mercy Mary, popularly known as a nurse with a difference, and I make learning easy and accessible for all my viewers. Today, we are going to be talking about this particular test known as HSG. HSG. I'm going to be telling you when this test should be done, what you should put at the back of your mind when going for this test, why this test is important when it comes to infertility, and also how this test is said to improve the chances of getting pregnant. But before we go into details into this class, if you are new on our YouTube channel and these are content you are interested in, please click on that subscribe button, turn on the notification bell so you don't miss out. For all my returning subscribers, this is Nurse Mercy Mary saying thank you. Let's go there. All right, welcome back. Now let's talk about this particular test known as HSG. So the first question is, what is the full meaning of HSG? It simply means hysterosapingogram. Hysterosapingogram. For my English students, I hope I'm pronouncing it correctly. So hysterosapingogram is an X-ray dial test done to visualize the uterus and the fallopian tube. It is done so that you can see the uterus and the fallopian tube. For scan cannot see the uterus properly and it cannot see the fallopian tube properly. So scan is just done normally to just check little things. But with this hysterosapingogram, they are able to visualize the uterus and they are able to visualize the fallopian tube. With this test, your fertility expert is able to diagnose some infertility issue with blocked fallopian tube and abnormal shaped uterus. You may want to ask, how is this test done? When it comes to this test, what happens is that they fill your uterus and the fallopian tube with dye. Like, dye, and let's assume, but this is a unique dye, different from the one you used to dye your clothes. So they fill the uterus and the fallopian tube with this dye. The outline of these things are shown in the X-ray. They are seeing it in the X-ray. So if this dye flows through the fallopian tube easily, that is to show that your fallopian tube is not blocked. If the dye just go through the fallopian tube easily. But if this dye does not go through the fallopian tube easily, there's a blockage, something is stopping it from going through the fallopian tube, then this particular individual could be having a blockage in the fallopian tube. So what your radiologist or your endocrinologist expert or the person doing that scan is watching is the movement of the dye, is the outline of that particular dye showing in the X-ray they are doing. So that is how this hysterosapingogram actually works. You may want to ask when it is done. When is it done? It is usually done during the first 2 weeks of your menstrual cycle. What do I mean by that? We all know that as a lady, we have different menstrual cycle. We have 28-day cycle, 32-day cycle. So the first 2 weeks of your menstrual cycle, after the last day of your period, that is when this test is being done. For example, I started seeing my period today and it ended 4 days time. So after my period ended, this test can be done. Yes, they do this test before your ovulation. They actually do it so that they are sure that you are not pregnant and you are also not menstruating. So it is done during the first 2 weeks of your menstrual cycle. There are also some certain people who should not do HSG. And one of those people is those that are pregnant. If you are pregnant, there is no need for you to do an HSG. That is why before the HSG, they have to confirm if you are pregnant or not. Even if it's your first 2 weeks of your menstrual cycle, a pregnancy test has to be done. And another set of people who should not do HSG are those with pelvic infection. Definitely, before they do this hysterosapingogram, your fertility expert or anybody involved is going to tell you to do an infection test. They will be able to do that. But if you have some pelvic infection, I believe your doctor will have it treated before you go for this HSG test. So the next question is, why is HSG part of the fertility test? Why do people do this HSG? I'm going to tell you. Like I earlier said in the definition of this test, it is being done to see the fallopian tube and the uterus, especially the fallopian tube. That is why most people usually do it, to see that fallopian tube, to ensure that that fallopian tube is not blocked, something is not obstructing the sperm. Why it's done is that when there's a blockage in the fallopian tube, egg cannot meet the sperm. When there's a blockage in the fallopian tube, egg will not be able to meet the sperm. And when the egg does not meet the sperm, or when the sperm does not meet the egg, fertilization is not going to take place. Trust me. Okay, so that is why they have to check, oh, is this woman's fallopian tube patent? Is this woman's fallopian tube open? Let's check with this test. That could be the cause of this woman's infertility. So let's check if these tubes are okay. So that is why they do this test. Because the sperm has to travel to meet the egg to get fertilized. And when this fertilized, this fetus that is being for has to travel through that same fallopian tube to come to the uterus to implant. So when the road is not clear, fertilization cannot take place and there cannot be pregnancy. So that is one of the reasons why this HSG test is part of the fertility test. So when preparing for this HSG test, you may want to ask, what should I do? The first thing you should do is to get your mind prepared, zero your mind from every negativity you are having in your mind. You get, just zero your mind off it. Sometimes they advise you take some NSAIDs, some painkillers to actually prevent pain during the process. The pain is not severe, it's usually mild to moderate pain that one experiences during this period. Or some research work says that NSAID, that's your paracetamol and ibuprofen, does not really have any significant effect in relieving the pain. So they said that you can use some antispasmodic. Your doctors are going to prescribe this for you, not me. So they might be able to use some antispasmodic, anticholinergic drug, and also hyoscine N-butyl bromide can also help to reduce pain in this particular process. You get, so these painkillers might be given to you by your doctors. These prescriptions might be given to you by your doctors before the D-Day, before coming. And also what is advisable is for you to get someone to drive you home. Okay, it's a quick procedure. You do it that same day and go back home. You don't have to be in a hospital. You can get someone to drive you back home just in case. It's important for you to get someone around with you. You don't have to go alone. You need a companion during this process. So that is what you should put at the back of your mind when preparing. Here are some things you are likely going to experience after this test. And this includes cramping. You might experience mild to moderate cramping after this test. And another is stomach upset. Yes, you might experience stomach upset. And another is a little vaginal bleeding might be experienced for a day or two after this test. But if the bleeding becomes severe, please and please kindly speak with your doctor as soon as possible. There are a lot of risk factors. No, there are few risk factors associated with this test. And one of it is risk for infection. I believe most of the procedures are done under sterile procedures, so the possibility of you getting infected is going to be low. So, but there is a risk of infection, risk of injury to the uterus, and also risk for allergies to this dye solution. You know, you don't know you're allergic to something until you are exposed to it. So if you are allergic to the dye, that can put you at risk for allergic reaction. Yes. So if you know you're allergic to any of the constituent that is going to be inside the dye, it's advisable you let your healthcare provider know about it. The next question is, can HSG clear blocked fallopian tube? I know you've been waiting for this answer. The answer is, if the cause of that blockage is very minor, is minute, is not big, like it's just having a small blockage, there's a possibility, there's a potential that that HSG dial is likely going to clear that minor blockage and allow fertilization to take place. So it all depends on the severity of the blockage. There's also what we call tuber flushing. Yes, tuber flushing is similar to HSG, just that HSG requires an X-ray to see, but with tuber flushing, an X-ray is not needed, but a dial is inserted to see how it can help flush the fallopian tube. So tuber flushing refers to a process of injecting dial into the uterus or fallopian tube as with HSG, but without doing an X-ray. Some studies suggest that tuber flushing improves fertility, especially during the first 3 to 6 months following the dial injection. Research shows that conception rate increases when the dye solution contains what is known as an oil-soluble contrast medium in particular. More research is needed for it to be considered as fertility treatment as well as a diagnostic procedure. Okay, so aside the HSG in helping to clear minor blockages, there's what we call tuber flushing that can be done. Most people report getting pregnant after 3 to 6 months after tuber flushing, but they said that a lot of research needs to be done more on it to confirm that tuber flushing can actually be a diagnostic tool and also a treatment tool for infertility. So I hope this video have been able to answer your question about HSG tests. Thank you very much for staying tuned. Thank you very much for watching this video. Don't forget to like, don't forget to subscribe, and also don't forget to share with a friend if you got value. For all my returning subscribers, this is Nurse Mercy Mary saying thank you. Bye and see you in our next video.